carrying out many tests on a routine basis, and if that's either positive or negative, we'll provide the answer once the testing has been. But at the moment there are 8 cases confirmed from the Diamond Princess. All are well in relative terms, all are in a mild situation on the advice that we have, and all are being well cared for. So those are the main things, other than to make the point that, as discussed, the Australian Health Protection Principles Committee has developed the Australian Health Sector Emergency Response Plan for COVID-19. On the weekend, I met via teleconference with all of the state and territory health ministers, as well as the chief health officers. We conducted a preparedness assessment, and I have to say that all of the states and territories are fully implementing and preparing for all of the elements of the plan. So I want to thank them for their work. Brendan?
Thanks, Minister. So, as the Minister said, our major concern at the moment is the international situation in those countries which have significant outbreaks, and we've seen further growth in the Republic of Korea and in Italy, and obviously that presents a risk to spread to other countries. And our concern now is the number of countries outside of China, making it more likely that we will have further outbreaks in Australia. But as the Minister's also said, we are still contained in Australia. We have no community transmission of this virus in Australia, and that's a really important message for the public, that there is no reason to change anything you do, wear masks or behave in a way that is different from normal. But we are preparing. We are preparing because of the developing international scenario, and we're working very closely with the states and territories who run the public hospitals, with primary care, general practices. Aged care is a big part of our plan, and obviously we are working on the basis of the plan the Minister talked about. That plan has to be flexible. It has to be flexible because we don't know if we do get further outbreaks here, what form that will take, how many people would be involved, how easily it will be contained, how easily we would be in isolating people. So the plan is very focused on flexible response, and it's also focused on proportionate response. So if we don't know what sort of severity this virus will have when it spreads into other countries, we're getting a better picture at the moment. We know that the majority of people who get COVID-19 have a very mild disease. That's the great majority of people, but we also know that a small proportion do get severe disease, and we have to be prepared for all eventualities, and that preparation, which has really been going for years on the basis of our pandemic flu plans, which we've had for a long time, they've been modified for this virus, and we are now doing sector-specific responses, predicting a range of scenarios. And sometimes you hear lots of speculation in the media about various scenarios and numbers. We don't know what scenarios will eventuate, but our plan has to be such that we are ready for whatever happens. Thanks.
You have produced a plan. This thing, yeah, it's quite interesting reading. In some senses, it's quite shocking. But can you take us through if a pandemic is declared? And it's not. This would be a matter for who to decide. But if it is declared, can you take viewers, listeners, readers through what would happen in Australia from enhanced screening, social distancing, and the like?
Sure. So if a pandemic is declared, but we're in containment in Australia, we will just continue what we're doing now. It's just a label. A pandemic is a label that simply says that there's sustained community transmission in several countries. We are already preparing for the eventuality that we have further outbreaks in Australia, should they happen. So that's what the preparation is about. So declaring a pandemic doesn't change what we do. What changes what we do is if we get further outbreaks in Australia, and we work out where they are and how we deal with them, how we contain them, and the size of those outbreaks, and then we bring into play those aspects of this plan that are relevant to the circumstances at the time. So declaring a pandemic doesn't really change what we're doing at all. more cases in Australia, community transmission in Australia definitely changes what we do.
What would happen then if you did have the instances of more transmission here in Australia?
Well, again, it would depend on the circumstances. If it's a small outbreak, we would move quickly to contain it as we have already. So the relevant public health unit would do contact tracing, we would isolate the people and try and prevent further spread. If you had much bigger spread, you change your response, and the plan deals with that. So you then move into a phase where you're not trying to fully contain, but you're trying to limit the speed of transmission. So all of those eventualities are predicted in the plan.
And further to that, with this plan, it's talking about the potential of school closures or workplace closures. What's the threshold for that to occur, and would that be nationwide, just in certain areas?
Again, as I said at the start, this is a flexible plan. It depends on the circumstances at the time. So if you had an outbreak in a particular city or state, you might, if it got to a certain size, you might then close the schools, you might change the configuration of the hospitals to deal with that. If it's in several cities and states, you do it according to the local needs at the time. And that's what we have learnt from repeated flu pandemics, is that you have to adapt the response according to the circumstances almost on a daily basis.
So, Minister, can I ask you, Mr. Chief Medical Officer, can I ask you about aged care? You mentioned it briefly, Professor. We've seen overseas the impact that this virus can have on the elderly. What measures are you taking in relation to aged care homes to try and prevent this spreading, particularly among those vulnerable people? And is that an area of risk?
We know that COVID-19, in particular coronavirus, as with flu, particularly affects the elderly. And it affects them because obviously their immune system can be weaker. So that has been one of our primary areas of focus in dealing with the states. We've been working to make sure that they have primary care facilities. The Department of Health has been in direct contact with aged care facilities, and what we are focusing on at the moment is a number of things. Firstly, that there are the containment processes to help prevent in terms of the safety, the processes with regards to hygiene at present. Secondly, that if there were an outbreak, there's an awareness and the ability to identify, isolate, and then ensure that the other residents are safe. And so that's been one of our highest priorities, because it is an area where we know that with the flu season in Australia, that has not uniquely but overwhelmingly had its most significant impacts on our older population.
I know it's a difficult question, but conceivably, how long could this crisis continue? Should we be preparing for months or weeks? Or?
Again, very hard to speculate. And one of the things that we would be very focused on if we got an outbreak in Australia is trying to slow the pace of development by containing cases, isolating, because a slowly evolving outbreak has much less pressure on the system. Even though it might have a longer impact, it is much easier to handle. So the modellers can give you predictions that could go from a few months to several months. And what we don't know, there is always a possibility with a new virus that it could persist and come back on a seasonal basis. These things we don't know.
Ellen, then Dana, then yourself. Ellen?
So, Minister, as part of your planning or preparedness on this, have you considered the possibility you might have to cancel events that have major crowds like the AFL?
So the possibility of events is always there, but that is a last resort. And so the way we think of this is as rings of containment. And so there's a very well thought through plan which we've enacted in relation to those community transmission cases. And I think that is important to recognise that at this point, although we are not immune to the virus, we are well prepared. We are as well prepared as anybody. And we've implemented that already. And so the idea of rings of containment is with individuals, families, or affected units. And if we can contain those, then we can limit the impact. So what we've done, as you would hope that a government would do, is to prepare for all eventualities. But so far in Australia, we have contained the virus on the official medical advice of the AHPPC. But this plan is about saying we're not immune, but we are as well prepared as anybody in the world.